everybody. This is Mike DeVries from Vanderlick Mulder DeVries and Elders. And with me today, I have Gray Mason. He is now the Executive Vice President of Exchange EDI. Welcome, Gray.
Hey, good morning.
I'm so glad that you were able to meet with me today. Gray, let me just explain a little bit what I have encountered with clients. And then I'm going to then turn it over to you, and you show us how your solution will help solve the issues that I see faced with clients. First of all, I have clients where I have been going into and looking at their accounts receivable, and I've been seeing their accounts receivable start to rise in 2014. And the average balances in some of these smaller practices, I see average balances of maybe $200, $250. And in looking at that, I started looking at their financial policies and meeting with the doctors and the office managers and saying, you know, could we change this? And so they said, well, what should we be doing, Mike? And I said, well, I think you need to be collecting the money from the patient at the time of the visit, because a lot of these payments or the amounts due from the patient are being applied to their high deductible plans. And so we need to collect that money more at the front door rather than sending out 2, maybe 3 statements and then trying to get the money or waiting for the insurance company. And a lot of times with the insurance companies, we send it out, and in 5 days we know exactly what the insurance company has paid, but we don't collect it from the patient that quickly. And so I started working with them and looking at the financial policies and cleaning that up and helping them get that straight so the patients knew exactly, they were educated on what our policies were. And then I was looking for a process where we would use a merchant company to store credit cards legally and start to use them for payment plans. And then one day I happened upon Gray again, and you have this solution, which I'm really excited about. And I'm looking forward to implementing this now with a client here soon, and hopefully with many more after they see what we're going to show them today. So, Gray, I'm going to switch things and give it to you. I'll just pass the presenter role over to you for now. And if you can take that and walk us through the product and the program that you have and how we're working together, that'd be awesome.
Perfect, Mike. Thank you so much. Yeah, just to kind of, I think, to dive in a little bit deeper on some of Mike's points that we follow very closely, the MGMA, the Medical Group Management Association, and you can look at their latest numbers out there today, and this shift in, patient pay is well underway, and the top bullet item up there talks about, that the patient pay is going to more than double in this 5-year window that we're at. That wouldn't be such an issue, but when you start looking at, the bad debt that's kind of going along with it, we are now starting to chase patients more and more, and it's very inevitable even when you look at these deductible plans now are through the roof. The average family deductible now is up to $5,000, and that's bad news for us in healthcare, meaning that we have to chase folks now, not only in Q1, but all the way to the end of the year, and, as high as $15,000 deductible plans that are out there. Mm-hmm. So, and when you look at that and you correlate that to, less than 5 years ago, the number that your patients contributed to your bottom line number was in single digits, and look where they're projecting what that revenue is going to look like this year. Yeah. So again, lots of challenges, lots of hurdles to get over. And then here are to the United States average, and just ask yourself, do you fit into these categories? Am I really taking 3.3 statements to send out before a patient will either respond or pay a bill? And then if that fails, do I traditionally roll it out to a collection agency? And again, this is the United States average according to MGMA, that they're returning $15.77 if you give them $100. And by the way, they get to keep 20 to 40% of this number, which looks more like $9. Right. So a very challenged process, and the whole idea behind it now is let's change this reactionary mode that we're in today to something that's more proactive and what Mike spoke about. So I'm going to flip over into that screen, but wanted to kind of give you, something that's happening in the market today, and as you follow this, why do we want to change and what are the things we're going to do about it, okay? So when you look at it here, here's the program that Mike was referring to. It's a web-based solution. You don't really need any hardware. You just need your Internet Explorer, your Safari, your Google Chrome, all that good stuff. You type in, the link, create a shortcut, and each user will have a login and a password, which from an office manager perspective or administrator has the ability to track all the different, things that we're going to do throughout the day. And when you log in, the system is connected up, meaning that it will talk to your current practice management system. We're agnostic to any system that you use today. And in fact, when you look at this, you'll see that it has abilities very easily to pull data over, which is your appointment schedule, demographics. Bottom line is it stops the duplication of data. So you don't have to go into those things. But what's very important here is I've got a lot of things that I can now start addressing in this patient payment world. And if we're going to pick on Dan Davis today here, these are your options of what you can do. This system is intended that it can tell me real time where the patient is sitting at with their out-of-pocket expense of today's visit, potentially a scheduled visit, surgical procedure, you name it. It can actually go out there and look at a lot of different things. And the way we do that is through the Quick Estimate button, which is a patient estimator tool. And that patient estimator tool will look at that plan, look at that out-of-pocket, look at the copay, look at the coinsurance, and then look at the fee schedule of your practice and come back and provide you what that out-of-pocket expense is for that patient. And then once you have that information, then it's a wonderful time to be able to talk to the patient about their balance. Stop chasing the patient, letting them out the door, going through the traditional, I'll send you a statement and we hope that you pay us. I now can then talk to them about cash check charge, maybe put you on an automated payment plan to help you pay for that, or still collect it all in one lump sum. So we'll show you some things of how we do it out there. So let's walk through a patient right now. So here's Dan Davis presenting in my practice. And when I get ready to do it, it's as easy as find my physician and what kind of patient visit is it. I have a few listed here that will actually create that visit, whether it's a pediatric visit, whether it's a orthopedic visit, primary care visit, whatever it is, just to kind of give you an example. But if I click on that and submit it, what it's doing is it's bundling the CPT codes of that visit. And this one was specifically, this patient came in with knee pain. It's looking at, in that estimate, those required CPT codes to come up with that portion of the patient responsibility. And the way we get to it is when I click that payment option, it comes up and you can see it's preloaded, those CPT codes for that visit. It's looking at your billed amount and your allowed amounts. It's looking at real time now at the point of care what that patient's responsibility is, and it's compressed underneath this window. But if I was to open that up, you can see right here very quickly, yes, the patient still has remaining deductible. Yes, there could be coinsurance that's applicable. And yes, there's a copay that's due. It juggles all that information, and as I move down the list, it applies it to today's visit. And so now I have information at my fingertips where I can now start to talk to a patient about their balance. And when I get to that point, here is the tool of the payment agreement of what that patient could potentially owe. It talks about the ability today of how do you encourage a patient that may want to pay today. And a lot of groups, just like collection agencies do after the fact, you now have the ability that maybe you want to discount that to collect the money or just collect it all. You can take that payment and you can collect it all in a one-time payment plan, or you can collect it over a period of time, $272 or $297 with the copay to be exact, is a lot of money to a lot of folks today. So I can traditionally put them in a payment plan with terms that you can discuss with the patient. When I click monthly, mine defaults to a 6-month window. And what this is going to do is it's not your typical budget module. It's a budget module that's going to go out and retrieve the money from the patient month after month, and you do not have to do anything after you set it up. So if you discuss with the patient, would they like to put it on their credit card or on their checking account, you can actually store a secondary source in case the primary fails, and then you just agree to when you want to start that payment plan for that patient. Once you're ready to go, you save and activate that plan, and it creates a nice payment plan for the patient. There's Dan Davis, talks about today's visit, talks about his obligation of what he owes. He can initial there. It talks about the breakdown of that liability and the payment plan details. Once they sign that and then you give them the agreement form and you get a copy of that, the patient's pretty much free to go, and you now have an automated payment plan that has been set up for the patient, and you no longer have to chase them, right? The big thing today is in our offices that don't have a tool like this today, we don't know what that obligation is going to be, so therefore we're hesitant to ask for the money. You now have a tool to be able to grab that estimate and require that payment plan. This solution is entirely set up so that this will replace your existing merchant processing program that you have today. So if you want to take a one-time payment at anywhere throughout the process, and a patient owes you $25 and you want to swipe a credit card, it's as simple as I have a plastic card reader connected to my system. I'm swiping it through the system. There is your payment. You click on continue and you submit it, and away you go, and you're done, and you print the receipt, or you can email them a receipt. So you can see from a standpoint of anywhere in the facility today, I can collect money and get it at any time I need to. It's also a great solution for the folks in the back office. So if I've got a patient on the phone that has a big balance, you can go right to the reoccurring payment plan by clicking it. And again, this screen looks familiar. Enter in the dollar amount, go through the payment plan, and the frequency of how quickly they want to pay, and save and activate that plan. So you've got lots of different options of addressing patient payment out there to be able to do those types of things. You can also communicate to your patients when you have the credit card on file, so that at any given time, when it's time for the patient to be able to settle that credit card on file, the system can also email messages out there. It can message to them via texting or email that you have a bill that's due. It can actually tell them if their transaction failed or it succeeded, and it can actually tell them that the plan has closed out, or even pre-notification that says, hey, Gray Mason, your $32 balance now with your card on file is going to auto-settle. It could send an email 72 hours prior to the patient, so that the patient could potentially call you up and take care of that bill, or they might have a concern or question about it. So a lot of ways that you can turn on mechanisms to start communicating to your patients to be able to do that. The last piece that I'll show you on here too is that as you're going through Meaningful Use 2 and a lot of different things, don't know if you know this, but you can also use our URL, which would basically drive off of your patient payment portal for your Meaningful Use, and it can actually have a patient go online and make a payment. So the patient can enter in their name, they can enter in their dollar amount, they're looking at their statement, and again, they can enter in their transaction. And again, for Meaningful Use 2, there's lots of ways of, as they're counting up, how compliant you are, financial transactions fall underneath that window as well too. So again, just to kind of recap, again, the ability to be able to grab the information from a patient, whether you're searching out grabbing a one-time payment, whether you want to grab multiple payments, whether you want to set up an estimate, you can all do it now from a web-based solution to be able to grab that from a patient. And then when you ask yourself and you're talking to your peers and your colleagues and your management team and your doctors, why should you do it? Here's a quick example of what our tool has an instant impact. When you guys are talking about an average of, let's just say I'm talking to a 3-doctor group today, and you guys are doing the average. You're sending out 3 statements per patient, and your doc is seeing 30 patients a day. And if your doctors are getting 4 weeks off a year, this little exercise is going to show you how many pieces of paper you're sending out today to try to collect balances. Our average across the millions of transactions that we see in our portal every single month says 50% of the time our practice is either set a credit card up on file or set up an automated payment plan. If you guys can do that, this is going to show you the number of pieces of paper that you're going to get rid of in your practice today. That calculation says that that's 18,144 pieces of paper. The experts would tell you that a statement to get it out the door with the lick it, stamp it, and stuff it, and the cost from your vendor, and you chasing patients, is well over $3 a statement. When you look at that today for a 3-doctor group, you can see that, you know what, when you talk about PQRI, meaningful use dollars, look what you can recoup by your practice learning 10 words. Hey, Gray Mason, can I keep your credit card on file for any future balances? And if they can do it 50% of the time with our tool showing them what they owe and giving them many convenient ways to store that on file, you can see that now you can turn your AR around instantly and very quickly. So that kind of concludes today, just high level of what we're doing. I'm going to turn it back over to Mike for closing comments, and appreciate you taking a look at this today.
Great. Thank you so much for giving us a summary of this. Really appreciate it. I think this is just, like I said before, I'm really excited about what you have to offer and how this will help my clients. If you want any additional information, I'd encourage you to give me a call at 616-949-9030, extension 12, and we'll set up an appointment and have Gray maybe even give you a little bit more of a full demonstration. Gray, thank you so much for today. Thanks everybody for joining in for this quick summary.